Good afternoon, everyone, and welcome to I believe we're on webinar number 5 in our series on the Child Care and Development Block Grant and the first 1,000 days. So this particular webinar series is focused on this idea of great beginnings for infants and toddlers. We're thrilled to have another large crowd with us this afternoon to focus on the concept of supporting quality in family child care settings. We know that there are lots of strategies and examples of working with family child care providers, and I appreciate folks have already jumped in the chat box and started sharing some of your most successful technical assistance strategies. This webinar is actually part 2 of a series that was focused on exploring strategies to increase the quality of family child care. Part 1 was about a month ago at the beginning of June, and we had a robust discussion and a group of participants sharing thoughts in the chat box, sharing resources with each other, as well as great presenters focused on helping to really understand the breadth of services that are delivered in family child care and a number of children and families that use family child care, and therefore how important it is that we are really intentional around our strategies for family child care. And we also started with the idea of thinking about support strategies and the concept of the Family Child Care Network. My name is Gina Capito. I'm a consultant with the BUILD initiative, and I was part of supporting the first webinar and have been joined by Danielle Fuentes-Johnson, who was involved in the first Family Child Care webinar and supported us with the stats around utilization, and Christine Johnson-Staub from CLASP has helped really think about the content for this webinar in order to kind of grow this thought process and continue to build our thinking as we are focused on family child care. It's such a engaged and participatory group of professionals, and we really appreciate that, and we hope that we can continue to use that chat box feature and continue discussion among participants as well as fielding questions to the speakers that we have. Because with the second part of this webinar, we want to continue this discussion around support strategies and successful ideas and strategies that may be applicable in some of your settings as well that are being used in a couple different areas across the country. And we also want you to feel that as even with almost 200 participants already joining us this afternoon, that you have the opportunity to pose questions to the panelists. And Danielle and Christine and I are going to be watching the chat and answering your questions as well as fielding them to the panelists as there's opportunities within their presentations. We're thrilled to have you here and continue the important topic. As part of this overall webinar series, which is supported by the Pritzker Children's Initiative, we have, as I mentioned, we are in the middle of a series of webinars that go all the way into October and are focused on real intentionality around decision making for using the Child Care and Development Block Grant funds to really think about care and support systems and services for infants and toddlers using those funds. In particular, as we are hoping for additional funds to be infused into state systems to support this work, we really want to be thinking about how we are being intentional and planful in using those dollars for infants and toddlers. As part of our overall series, as we've talked about in a couple of the webinars, we have a set of core principles that underlie the work as we're approaching the content for the webinars and the blogs that are part of this work. And I'm just sharing a couple of these core principles as we think about approaching family child care work this afternoon. The first is this idea of making sure that we are inclusive of all settings that serve families with infants and toddlers. And that in particular I draw out because of the fact that we're focusing on family child care today. And as I mentioned at our first webinar of this 2-part series, we did really highlight this idea that there are so many children and families that are choosing family child care settings and how important it is that we are aware of and approaching those providers as part of the overall fabric of our early childhood system, particularly in how we think about using the Child Care and Development Block Grant funds. And then also acknowledging that in many instances, in many communities, family child care is serving many of our most diverse families, both economically and racial diversity and cultural diversity of our families. And so we really want to make sure that we're thinking about equitable solutions and equitable approaches to working with providers and to supporting the children and families that those providers are serving, and that we are starting from the beginning and really trying to set a strong foundation of equity across the settings, the communities, and the children and for the children and families. And so those are just 2 samples of the core principles that you'll hear throughout all of the webinar and blog content as we proceed forward with this approach to really thinking intentionally about infants and toddlers as part of the Child Care and Development Block Grant. I do want to give you a quick overview of this afternoon's webinar. Before then, I just give you a snapshot of our speakers, and then we move into our content for this afternoon. So we are going to talk a little bit about this idea of the range of quality supports for family child care. We are then going to go directly into hearing about a specific family child care network example, and that's the Pathways to Community Action model, which is based in New Mexico, and we're going to explore some strategies of quality supports that the Pathways to Community Action Network uses, and their work in getting providers, outreach to providers and getting providers into the various systems that are available to them within their community. And then we're also going to then move to thinking about the idea of quality supports even more broadly, and we're going to explore another model for quality supports for family child care homes, and that's the Parent-Child Home Program. We're going to discuss that program kind of at a broad approach, and then we're also going to hear from Massachusetts and their implementation of the Parent-Child Home Program for family child care providers within their state. And so our strong lineup of panelists that are joining us to cover this content starts with Adrienne Perdoza, who's going to be sharing and talking more about the Partnership for Community Action Family Child Care Network, as I mentioned, based in New Mexico. Then Michelle Morrison is joining us from the Parent-Child Home Program, the national office, and will be introducing the technical assistance model that Parent-Child Home model is. And then Karen Rowe from Massachusetts will be talking specifically about the implementation of the Parent-Child Home Program within the state of Massachusetts. So through this approach to today's webinar, we do really hope that we are bringing out several different strategies and approaches to quality supports for family child care homes. I'm sharing this particular slide with you as something that we discussed when we introduced the concept of family child care networks, and I just want to do this as a quick thumbnail kind of reminder around the idea of the variances in not just family child care networks, but also the variances in supports for family child cares as a whole, and that's partly what we're going to be thinking about today. We do have a network example, but I think as you're hearing Adrienne share some of the strategies that are used through their network, you're going to hear things that are applicable whether or not you're currently implementing a family child care network. There's also going to be strategies and things that you could apply in working with family child care homes. And then when we hear more about the Parent-Child Home Program, technical assistance model, again, you have the opportunity to kind of acknowledge that it can be done within the context of a network structure. It also is a support and a strategy that can be done without the framework of a network structure as well. And that's one of the kind of examples of quality supports that I wanted to highlight today, is that there's, and why I asked for you to share in the chat kind of your most successful technical assistance strategy for supporting family child care, is to kind of get that concept, get it rolling and get us all thinking about what are some of the other examples that are out there, because I think there are so many opportunities to do quality support for family child cares with or with outside of a network, and the types of services, how intense the services are. These are the types of things that vary, and you have the opportunity to think about some of these examples and how they may be applicable to your work, or what you may be able to adapt and apply to your work in your individual community. So at this point, with just a little bit of an introduction to the idea of the breadth of quality supports that are out there for family child care providers, I would like to turn it over to Adrienne Perdoza to introduce and tell us more about the network model that's used at the Partnership for Community Action.
Thank you for that. I appreciate the invitation to be on this call and to present our model that we've been implementing over the past few years at the Partnership for Community Action. I had the privilege of serving as a social enterprise director for many years, several years at the Partnership, where we help develop and start the network. I'm now the Director of Strategic Partnerships for Abriendo Puertas National. It's a parent engagement curriculum for Latino families that does work in 38 states. And we here in New Mexico actually got started with the Abriendo Puertas curriculum as we engaged communities and families that helped actually lead to the network. Okay, the Partnership for Community Action, our work is really about engaging families and communities. We serve families from an advocacy as well as engagement perspective. We work on various different issues related to early childhood education, economic development, community building, and our work around early childhood education, as I mentioned earlier, was really based around engaging families, many Spanish-speaking families, immigrant families here in our community in the South Valley. We've been doing this work for about 27 years here in the older, more historic parts of Albuquerque. And we like to describe our organization as a flexible, nimble organization that really responds to the needs of our families and communities. And so sometimes, in the case of this network that we help develop, it really is an initiative that was really driven from the community, that is really listening very intentionally to what their needs are and being able to respond and build infrastructure and support around what we're hearing. The name of the network, Educadores para los Niños del Futuro, or Educators for Young Children, for our future young children, is really a network that is inclusive of family child care providers. This is a network that was really born out of the leadership of the child care providers themselves. They provided the leadership to the network. They helped develop the solutions or the strategies that are developed out over year after year, and it really is a network that is really led by them and owned by them themselves. We did initially, when I say we kind of stumbled upon this, I say that because this wasn't a grant-driven initiative. We didn't receive first a grant and then sort of expect providers to sort of fit the goals of a grant. It really was born out of their feedback, the set of solutions that they were describing, and then we built some grant funding around that. So we were fortunate enough to have some foundation partners that understood that this work was sometimes slow and that it had to be flexible and responsive to their needs. And so we had some foundation support to really help to do that intentional listening and that leadership building that was required in order for this to be a truly provider-owned and led network. This initiative was born out of a community-based assessment, participatory assessment project that what we were hearing from families as we engaged them in the Abriendo Puertas early childhood curriculum is that many of our parents were telling us anecdotally that they were choosing to provide home-based child care for their children at the earliest years. They were not sending their kids to centers, to early Head Starts. They were really choosing a home-based environment, whether it be a family member, a neighbor, or even a stay-at-home parent. What we also started to hear from families is that they felt as though the home-based providers were not feeling supported and were feeling isolated in their approach, in the way they worked with children. They didn't feel like they had a lot of support. So we set out to do a community-based participatory research assessment where we invited some of our family leaders and even some of the providers to work with the University of New Mexico to actually go out and to develop an assessment tool and to interview home-based providers. And we asked them several questions, and some of them around what their needs were, where their gaps were, where they saw opportunities to actually grow their services, and more importantly, whether or not they saw this as a business, whether or not they wanted to grow as a business, improve their quality, and improve their revenue streams. And what we heard was a resounding yes, that they really saw this as a way to supplement their income, that they were doing this because they love children and they love to engage children. They saw themselves as teachers, but also that they wanted to grow their business, and they saw this as a way for them to generate income while maybe they have small children also at home. So this community-based assessment really informed the next steps, what actually turned into the network. After we did the assessment, we invited those that were interviewed, those providers, to actually participate in building the leadership and building the structure of what eventually became the network. Just to talk a little bit about the specifics of the structure of the network, the meetings are held once a month on Saturdays for obvious reasons that a lot of the providers cannot come during the week, or by the evenings they're too tired, or they're taking care of children up to 6, 7 o'clock in the evening. The governing board is really made up of the providers themselves. They elected their own leadership. They have developed their structure with our guidance that allows them to really own the network. There's cohort of groups that were broken up into registration, licensure, and commercial facilities. These were not committees that were determined by us. They really determined these committees based on what they saw as their needs as providers. We then connect them to resources that we know of. We don't do this alone. We connect a lot to our universities, our colleges, our Children, Youth, and Family Department to actually make sure that they have the technical support that they need in order to increase the quality of their home-based child care services, as well as to improve their business model. There are many external partners listed there. Some of them are obvious partners and some of them are not, like the fire department. One of the things here in New Mexico, is, of course, is they have to have their home, if they're a home-based business, they have to make sure that they're in compliance with fire department regulations. And so they have actually become a very strong partner of ours, helping families, family home providers to ensure that their place is safe for children and families, and they actually even do workshops for our network. Just some of the quick outcomes or successes we've had. And again, I will say that we're very proud of this because we really try to meet our community where they're at. And in this case, providers are no different. We really took the time to understand where some of their barriers, where some of the deepest challenges were coming from. And a lot of them had to do with their feeling of isolation and just feeling like they were not connected to the sector of early childhood education, to other centers, to other home-based providers. And so these results are really built upon the leadership of the providers themselves that organized and that worked together and worked with their ally organizations to make sure that their most immediate and pressing needs were getting addressed. We had situations from the very beginning where some of our Spanish-speaking providers didn't have access to the right forms, in the language that they could understand. So we actually worked, they worked to change and to make sure the Children, Youth, and Family Department out of New Mexico provided translation, and the forms were translated for them, so that way they can, not only they, but future providers can also understand them and be able to navigate that system. Zoning issues was a huge issue that we're very proud that the providers organized to get some zoning regulations actually clarified. It turns out that here in our county, our zoning department and our zoning administrators were actually they misunderstood their own regulations and had to go back and change the way they were implementing some of the zoning requirements that was preventing home-based providers from taking care of children up to 12 children. They were being prevented. They were being asked to stay at no more than 8 children, and with the right facilities and the right improvements, they actually reclarified their own zoning requirements that has now allowed dozens of providers to be in compliance with the county and to grow their home-based business. So those are just a quick overview. I know I've spoken very fast. We're very passionate about this work and about what this means for how the work can look in the future, because we felt as though this beginnings of the development of this network was really organic, and we are now working to actually codify and to formalize a lot of the structure of the network in a way where they can be self-sustaining, where they can receive support from maybe our federal, state, and municipal partners, so they can make sure that they continue doing the good work, reaching out to other providers, and ensuring that our youngest children have high-quality home-based care.
Adrian, we have a few questions that we'd like to follow up with you on. I want to start with, on an earlier slide you shared that there is a fee. I believe it was for 2 years, it was $50. Can you speak to kind of the origin of that? Was it part of the network from the beginning, and how was the amount determined? Was it determined with FCC providers? Just speak a little bit about that. I know a lot of networks grapple with whether to charge a fee or not.
Yeah, thank you for that question, and that's always a difficult, thing, because we do serve, home-based providers that many times are under-resourced. They're already, strapped for resources themselves. But the actual network decided upon that fee themselves. When we asked the members as they were developing their strategies, if they wanted to start to grow a budget in addition to what we had provided from the foundation support, they felt as though it was important that the providers themselves were sort of bought into the network, and they felt as though that very reasonable fee was more than worth the return, the technical support that they were getting, and the peer-to-peer support that they were getting from other providers. That money went into a fund and helped pay for things that above and beyond what the grants would pay for, but food for meetings, or maybe they had some transportation issues to get to and from each other's centers as they were providing each other peer-to-peer support. So that is really a fee that they decided upon themselves, and that we of course supported that desire of theirs.
Wow. There another question coming from the panel combined with I'm going to combine a couple together. There's a question about the idea of, I wanted to hear a little bit more about outreach, especially because you mentioned that the large number of providers that have gotten licensed as part of, after they become participants in the network. And so it's a question about the outreach of how you get to those kind of unlicensed providers. And then there's another subset to that question, is a little bit about how your governing board is made up. Is it made up of just licensed providers, or do you also have license exempt, and how do you encourage them to participate in the network?
No, thank you for that question. Yeah, all the governing board, they are licensed providers, but they maybe started off as unlicensed or just registered providers, or some of them completely off the radar, weren't registered. So they have worked through the process and have learned a lot in the process. So we're elected governing board members, but they are all licensed providers at this point. As far as reaching those that are even unregistered here in New Mexico, that are off sort of our Children, Youth, and Family Department's radar, we really pride ourselves in that sort of very on-the-ground, sort of door-to-door work that needs to happen in order for us to reach those that might not be reached by our traditional systems, right, by our state systems and our local systems. So and this started off with the community-based assessment. What happened is the word of mouth started taking off, and we never sort of turn somebody away and say, wait a minute, you're not registered, you're not. We always invite and welcome anybody to come to the network meetings, and because what we feel is though when somebody comes to us or comes to the network, that they come with the intention of wanting to become registered and licensed, that they want to work towards that high quality, those high quality early childhood services. And so we get a lot of folks coming to us that hear from other providers or hear from families that, hey, if you want to improve your services in your home, if you want to become licensed, they can help you. So we pride ourselves in really engaging those that are unengaged by our traditional systems.
As part of engaging the providers in other systems, do you partner with the National Association for Family Child Care? Mayra Acevedo, my colleague who works more directly in building the partnerships, would know that. I believe so. I'll say this, that we partner. We have many partners, and we take any support that we can get for our providers, because we know that we cannot do this alone, and that there's expertise that we don't have that a partner might have. And so we have, as I said, worked with our colleges that provide workforce development. Many of our providers have gone through certification process for early childhood through our local colleges, community colleges. That's with a partnership with them. They've received TEACH scholarships from the state to actually go through those courses. So when we have an opportunity to partner with somebody that is okay with our authentic engagement, making sure that we are being responsive, that this isn't about meeting a grant requirement, but it really is about responding to their needs, then we take that partnership and we work with whoever can help us accomplish that. Okay. Great. There's a couple more that have come in. There's a lot of interest in the zoning, and if you could speak a little bit more about how you worked with zoning as other states are expressing that they've had issues with.
Yeah, and that's it's one of those things that you don't think you're going to enter into in this field of work, right? Is zoning issues, but our organization actually has a history of working on zoning issues because of some of our community building revitalization work that we've done. So we were fortunate to walk in with some expertise and some know-how in that area. But it really is, when it comes down to it, about listening to some of the issues that our providers were having, and not sort of not being okay that that's just how the way things are. We really try to understand where some of the details of whether or not they needed sprinkler systems or whether or not they have the right space for their children, understanding where some of those detailed needs were coming from. And then after a year and a half of just really hearing these stories and documenting them, it came, it's sort of the providers themselves realized, wait, something's not right here. We pulled the code, the county code, and so what happened is we actually, upon knowing that there was an issue and that we felt as though there was some misinterpretation of county ordinances, we approached the county commissioner with the providers, and they held that meeting with the county commissioner and expressed where their issues were. And this county commissioner wants, he believes in early childhood, but also wants to see small businesses thrive. And so they approach this from a small business perspective. We have, several women-owned small businesses that are operating child care centers in their home. And here's the issue we're having. He listened. He engaged the zoning department, and within a matter of really about 3 months, they came back to us and said, you all are absolutely right. We're misreading our own zoning ordinance. And so it took some work. It took some research. It took some technical support. But again, it was about listening to where the issues that they were telling us, where they were coming from, where they were stemming from.
That resonates so much with a couple of the things that we've heard in the chat around the most successful strategies that folks raise. The one raises the idea that having been a provider or continuing to be a provider and then working with other providers and really understanding the struggles and really listening to each other is part of it, peer-to-peer discussion, and then hearing what that peer-to-peer conversation is and feeding that into your strategies is such a critical piece, so that really resonates with it. Before, Adrian, before we let you go, there's one about whether or not the FCC providers participating in the network receive higher rates or more money because of their participation in the network.
Absolutely. I mean, and that's not even, I would say, provided by our organization, but as they go from being unregistered to registered to licensure, we have several providers that have actually gained pre-K status and approval through an application that we helped them to understand and to fill out that to go through that process. So they have seen a direct increase in their household income and in their business and in their reimbursement rates. And so we're very proud that they're seeing direct results from their work as they work with us to improve their quality. And you're absolutely right. We really see this as a community of providers that learn together, that gain an understanding of each other's challenges, and then work together to build those solutions. And so whenever one provider faces a zoning issue or goes through licensure process or gets that pre-K approved, what happens is that provider then, we provide the space where they can share that experience and that story with others. So the next time around, that built-in expertise is built in within the network. And that's, I know, something that is hard for any one organization to staff, or with the system of, many times of people that many times don't leave their offices or, are in a state office or, it really allows them to have a partnership with providers on the ground that want the same end goal as they do, that know where to get the answers, but that can also help them meet their goals of increasing high-quality early childhood services in people's homes.
One last question. There was a question about whether or not providers are participating in and giving input to the Power to the Profession initiative.
That is an initiative I am not familiar with, so and maybe I will ask Maida, and I can post that to the.
Okay. Yeah, we'll send that one to Myra. But then also, it was raised by a participant, Ida Rose. If you have a link and you'd like to share in the chat, it might be something that would also be educational for other participants on the call to share more about the Power to the Profession initiative.
Great.
And thanks, Joe, for sharing a reference for more support around zoning, landlord, homeowner association issues, those types of issues that family child cares often run into. We'll also see if we can pull a link and post a link there for the Child Care Law Center in California.
Wonderful.
Well, thank you so much, Adrienne. I really appreciate your content and starting us off thinking more about how to reach and work directly with in a responsive way to family child care providers.
Thank you for having me.
Great job with this. So everyone, if you continue to have questions that are specific to the Partnership for Community Action program, do please post them in the chat, and we will send them to both Adrienne as well as Myra, whose contact information is also on the screen. Adrienne, due to another commitment, is going to have to ring off of our webinar before we're done, but do continue to send questions if they come up, and we will communicate with Adrienne as well as Myra. Thank you. So now we're going to continue thinking about these concepts of quality supports and the different types of ways in which quality supports are delivered, and we're going to move to talking more about the in-home supports for family child care providers through the Parent-Child Home Program. And I'd like to have Michelle Morrison from the National Office of the Parent-Child Home Program join us now and introduce the supports for family child care programs.
Thank you so much. I really appreciate the invitation to participate in the webinar. My name is Michelle Morrison. I'm Director of Training and Program Support at the National Center for the Parent-Child Home Program. And some of you might be familiar with our program. We're a national home visiting model that works directly in parents' homes. So our typical work in what we're calling our core model is to work with parents in homes. And here on the slide is laid out on the top what the PCHP core model is, which is a home visiting program for a parent or primary caregiver who is regularly available to get twice-weekly home visits. Our home visitors, who are called early learning specialists, bring in toys and books for the parents to use with their own children every week. And we're a very intensive home visit model aimed towards under-resourced families. So our families typically are low income and or are immigrant refugee families or have a low level of education. That's our target audience for our core model. And within that core model, we're serving families who have children ages 16 months up to 4 years of age. And a continuum of services that generally go on into pre-K after families graduate out of our program. So we've been around for over 50 years. We're in about 120 sites nationally. We're in 15 states nationally. And we're also an international program, so we're in other countries as well. So over 50 years of serving families as a home visiting model, we have certainly encountered parents who are doing child care in their homes. That's quite common in low-income communities. And so over the years, in little pieces here and there, we have directed efforts more specifically to family child care providers. And then starting about 3 years ago, we really formalized a curriculum that serves family child care providers using many of the same strategies that we use with parents. So our emphasis is on early literacy, on the provider increasing verbal interaction with the children, on using literacy-rich materials that we bring to the provider, and that also gets sent home with the children in care. So this is what the program model looks like. It's a very intensive model on purpose. It's for providers who need a lot more support. And so the model provides an early learning specialist who comes into the home for 45 minutes 2 times per week over a period of 1 year for 48 visits total. And in our pathway for licensed providers, that early learning specialist is bringing in both books and educational toys that are permanently left in the child care setting. All of our books and toys are paired with what we call guide sheets, which is basically a curricular sheet that the provider gets to have and to access, and also a curricular sheet with the books that goes home with children in care. Our strategy is around modeling reading and play activities. It is very much non-didactic and non-threatening. We show the provider ways to use the toys and books that will support children's literacy, and also we try very much to support the sensitivity of the caregiver to the children in care, so that we see that the caregiver really puts some effort into both verbalizing and listening and being sensitive to the children's needs. We're very much experts in parent engagement, and so I think a strength of the program is that we do have an emphasis and techniques for engaging parents as well as providers. And we do make referrals to other educational services as needed. So we're building on the best practices that we know that exist in the core model. So for example, we are trying to change parent behavior in the core model and in the way they interact with their own child. In the family child care model, we are trying to change the way that the provider is behaving through modeling interactions with the children. In the core model, we enhance the home learning environment by bringing in all these books and toys. In the family child care model, we are doing the same. We're bringing in free books and toys that the child care provider gets to keep to enrich her environment.
Michelle, before you go on to the next slide, could you just clarify that 2 visits per week for 1 year equating to 48 visits? There's a clarification on your earlier slide.
Okay. So when we talk about a year, we're not talking about a calendar year. We're really talking about a program cycle. And originally in our home visiting, in our core model, the program cycles were based on a school year calendar. So most of our sites who are doing the family child care model are positioning the scheduling within a school year calendar, and often are not starting visits until late in October and usually ending in May. And that accounts for some makeup visits during the year, and it accounts for school vacation periods when visits might not be taking place. So what we're calling a year is not the equivalent of a calendar year. If again, comparing what we're doing with parents, with parents we're doing one-on-one modeling of reading, conversation, and play activities. And we're doing the one-on-one activities with the family child care provider, but with groups of children of multi-ages. So of course that's very different than the model when we're working with parents. And our core model, we provide 23 books and 23 educational toys in the home over the course of 2 program cycles. We do, for licensed providers, provide less of those items, and that is because in the sequence of the visits that we do also have visits that include art activities and music and movement activities that we don't count in terms of the books and toys brought in, although materials are brought in during those visits. And we give the provider an opportunity to implement her own activities as well. That's built into the model, so that the provider is initiating activities through the coaching of the early learning specialist who comes in. You can see in the core model, we are actually going over 2 school years that add up to 92 visits. Right now in our family child care model, it is the 48 home visits in a 1 year or 1 cycle. Our programs out in Seattle who are doing the FCC model are doing a 2nd year with their providers. That's a little less intensive, but they made a decision, and their funder made the decision that they wanted the providers to carry on for another school year. And in both models, we definitely connect families to community services. So we want to make sure that if a child in care has a developmental issue, that we assist the provider in connecting that family to other resources in the community. Again, when comparing our 2 models, in our core model we do detailed measures of parent-child interaction. In the family child care model, what we're looking at is the provider behavior and the parent and the environment. And for that, we're using the FECRs as a pre and post. We also do detailed long-term measures of child outcomes in our core model. In the family child care model, we have just completed a process evaluation that I'll talk about in a moment. But we're looking for changes in the home environment and also, again, in parent-child interaction in this model as well, and we're seeing results of that. So right now what we've been doing up till now is only building our family child care model on existing parent-child home program sites. So our assumption is that the staff at these sites have had a tremendous amount of training from us and understand the parent-child home program strategies. They are very much community-based. They're very trusted in the community. And then we're building on those existing resources. So when I talk in a moment about the research outcomes that we have found on this model, that's assuming that that's a parent-child home program that has included now the FCC work. Oh, my slide. Oh, there it goes. So, I just wanted to mention that a lot of the work that we're doing in terms of providing professional development to family child care providers is very different than what we're doing. We're not classroom-based. We don't ask providers to come out on a Saturday to come to a meeting. Everything that we do is in the home, and everything that we do is based on wherever the family child care provider is in terms of our own development as a provider. We start where whatever the provider's skills are, and we build on those strengths and suggest new ways to approach her work. And we know that the opportunity to practice is really a good way to make change happen in terms of behavior. So that's one of the great things about doing home visiting is there are opportunities to have mentored practice. I'm not going to go over all the details on our target outcomes, but you can see that we are targeting provider outcomes, changes in provider behavior. We're targeting, of course, the children in terms of seeing better development in terms of early literacy, social, emotional, cognitive, physical, and early numeracy gains. And specifically, I want to point out that we're also targeting parents in this model because that's our specialty is working with parents. So it is part of the model that parents are always included. The books go home with the children. There are guide sheets that go home with the children to the parents. Also, a lot of our sites are doing parent meetings, orientations, newsletters. So we're always keeping parents involved in the work that's happening within the FCC home. So just to give you a list of the states that PCHP is in, here is the list of the states. The ones that are starred are the ones who are doing our FCC curriculum as well. It mentions Minnesota starting, and yes, they will be starting in 2018, in the fall of 2018. So very quickly, I just want to go over some research outcomes, and then I'm going to give this over to Karen Rowe to talk about what's going on in Massachusetts. We had an outside evaluation firm called ORS Impact do a process evaluation on the program. And here are some of the findings from our sites. In terms of the FECRs, I'm not going to go over every detail, but you can see the greatest improvement was made in listening and talking subscale, but also increases in a number of other of the subscales as well. In sensitivity and reciprocity, we're seeing again a significant change in terms of where the providers wind up at the end of the program year. And this is measured through the caregiver interaction scale, which is one of the measures that we're using in our model. This process evaluation also included some focus groups with coordinators who are our supervisors at our sites and the early learning specialists who are the home visitors. And here are some of the things that we saw increases in: increased parent engagement, increased verbal interaction, an increase in being self-reflective on the part of the provider, which is great, adapting curriculum to align with the curricula that we have here in this model. And even we saw some demonstrated better health practices, which was interesting because it's not something that we're specialists in, but apparently that's happening as well. Among the parents, we use strategies such as letters home explaining the program. Some of our programs do home visits directly with parents in addition to working with the provider. An open house, calendar sent home, developmental checklist sent home. We're seeing more parents showing up in the provider's home and wanting to talk to our early learning specialists. So there's been a lot of engagement that some of it is quite surprising. Parents are saying that they're using the guide sheets that go home with the books quite a bit. We are getting a lot of feedback from parents that they're reading more to their children and that the child's coming home with the book and saying, this is what we read in care today, this is what we did, and Mommy or Daddy, would you please read the book to me? So we're getting a lot of feedback from parents on this. We're also very interestingly seeing that screen time at home is going down, which I think maybe is a reflection of the suggested books and art materials and art projects that we're sending home to parents, with some suggested activities. So we're seeing a decrease in screen time at home. So that's quite interesting, I think. And that the parents are reporting back increased interactions with their children at home, with the number one thing being reading more to their children and increased verbal interaction. Our home visitors, the early learning specialists, are also reporting positive changes in children throughout the course of the program, which to me is not surprising that we're seeing increases in language and vocabulary, increase in identification of colors and numbers, more engagement and enthusiasm for activities, greater interest in reading books, and just things settling down within the provider environment. So things are getting calmer. There are schedules that are more predictable. We certainly are getting providers who are telling us that they consider themselves teachers now rather than babysitters. So that's a wonderful feedback that we're getting from providers. And here are some of the changes that parents have reported in their children. Number one being that parents reported the greatest improvement in early literacy skills. So that's an overview of the program.
Michelle, there are a few questions. Yeah. I'm wondering, some of them might be really well suited to Karen answering as part of her presentation about recruiting providers into the program as a state example. But I'm thinking that there is one related to your demographics, the question about how closely the demographic characteristics of the early learning specialists reflect the characteristics of the caregivers they're serving.
Yes. I think that's a great question. So one thing that Parent-Child Home Program is very deliberate about is that we pick early learning specialists from the community, that we try to match both language and culture for those early learning specialists. So we have over 52 languages spoken in our core model, which is amazing, and we're able to make a lot of good language matches. So yes, our early learning specialists are totally reflective of the community that we're serving.
Great. And then the second demographic question is this idea of whether or not infants and toddlers are served in the program. I know that given the huge number of infants and toddlers that are served by family child care providers, but do you happen to have from the data that you've captured what percentage of infants and toddlers are the makeup of who providers serve?
Yeah, I don't know the data offhand, but when we're working with multi-ages of children, we definitely include what we're targeting is infant up to age 5 in this program. So it's very different than in our core model program that specializes in 2- and 3-year-olds. And if you see one of our sample curricular sheets, you'll see that there are tips for every age group. So how do you use this book with a different variety of ages? How would that work? How would you use this particular toy with a different variety of ages? And those curricular sheets go into a lot of detail on how to do that.
Right, based on child development. But yeah, given that we know how many infants and toddlers are overall in family child care, it's safe to say that the Parent-Child Home Program is reaching a lot of infants and toddlers.
Yeah, I think so.
So there are several other questions for Michelle, and I think we're going to be able to answer some of those directly with Michelle at this point because of an interest of time. I want to make sure that we do hear from Karen Rowe with the Massachusetts implementation, because I think some of these ideas about recruiting providers and training them to implement the model would be great to hear from Karen and her experience in Massachusetts. So Karen, if you're available. I know Karen's having a little bit of technical difficulty with the webinar room. So
I think I've got it, so we'll see.
Got it? Okay.
Yeah. Thank you so much. I'm happy to be here talking about how we've implemented the program in Massachusetts. So we received a 2-year grant for a pilot program, which actually began in late March of 2017 and just ended this June 30th of 2018. And our agency has been coordinating it. And we just recently received a new grant to continue our work for PCHP for FCC for at least the next 2 and possibly 4 years. So we're really excited about the work. The grant was funded by the Department of Early Education and Care, and it's a collaboration of several different agencies and 2 school systems around the state that are listed there. And we all have in common that we run a PCHP program. So we're running the CORE program. And typically the coordinator for the CORE program jumped in and started coordinating the PCHP for FCC program. So at least all our coordinators have had that experience, and many times the early learning specialists that went into the family child care homes were also early learning specialists who are also doing the CORE program. So there are many different pilot sites going on in the past couple of years around the country. And you can see our site is the Massachusetts. Our grant is in the blue because we were 6 out of the 7 sites piloting the program in Massachusetts. There was another group that had some private funding. So we worked with 29 educators in the 8-week program. And the 8-week program happened because once we got the funding, it took us a while to recruit and hire the right people. And so we started visiting last year in late April and early May. So we had up to June 30th of 2017 for that program. So at that time we decided to use that 2-visit model because it just seemed like it would work better. It's what the ELS were familiar with, the early learning specialists were more familiar with. And we also, it allowed us to bring more books and toys into the homes and demonstrate different ways for them to use them. And most of the agencies used the curriculum that was provided by PCHP National, although a few made some adjustments. So our goals from the Department of Early Education and Care were to strengthen the knowledge, skills, and tools available for the educators to enhance early literacy and school readiness. And we feel like because the providers were reporting increases in all the skill areas, and as you'll see from our other results, we were getting good positive outcomes even from that first 8-week program. So we were using professional development offered in this program and using the mentorship of the trained early learning specialists, and that helped the FECRS and the CIS scores increase. We're just getting preliminary results for year 2. As I said, it just finished, and the numbers look good.
Karen, can you speak to the qualifications of your early learning specialists?
Sure. To be an early learning specialist for the CORE program, it's a paraprofessional model, and for this FCC educator program, it's a little bit more of a more professional model. We were very fortunate to have several people who had experience in early literacy and early learning, some that were teachers taking a break for whatever reason, who wanted some part-time work. And I think throughout our program, we had a variety of educators with a variety of backgrounds, but they all had at least the experience of working on the CORE model and a lot of early childhood education experience.
And then you had specific training for the FCC
we had
model?
A lot of training, yes. The National provided 2 days of training for the PCHP model. And we also provided, through the state, we did some training on QRIS and FECRS because these were things that we weren't using in the core model that people weren't as familiar with.
Sure. That makes sense.
Yeah.
So that's more that to speak to, there was a question about that idea of how do you train them to effectively implement the model with providers, so that additional QRIS and FECRS training. Okay.
Right, and I think I addressed it in a later slide that what we did was after the 8-week program we kind of looked at what were the areas we needed to really give the ELS support and training in, and we had helped them with learning about the culture of the FCC educators and working with groups of multi-age children and things like that.
Mm.
And we were working with only licensed providers. We worked with 39 independent and 26 system providers in our 2 years of our program. The Department of Early Education and Care wanted us to work with providers who accepted vouchers to assure that we were working with people who were serving needier families. And also their focus on this grant was for independent providers.
Great, thank you.
Yeah. So we had a much shorter time period for the program that we did at that end of last year. That was the 8 weeks, but it still achieved a lot of positive outcomes. And in that abbreviated program, you can see that the caregiver interaction scale went up by 12%. And the FECRS, all areas of the FECRS increased, but especially the provisions for parents increased the most. And we provided a lot of opportunities for parent engagement. We tried to do a monthly parent engagement, which involved like a meet and greet in the beginning, a pizza at pickup. Some providers did an art show where they used the art that the children created during an extension activity and discussed it with the child and wrote down what the child said they were drawing about, and then they posted that in the provider's home. And during pickup, the parents could go and look at all the different art projects. And we also did a lot of year-end gatherings, literacy nights, things like that. And in the abbreviated program, the parent surveys were very positive. The people were reporting having a lot more conversation with their children, reading with their children, and using the books and the guide sheets that were sent home from the program. And the providers really loved it. The providers really wished they could keep going with the program. It was sad when we had to say, no, we have to go on and use other providers. But they really had a great time. The children looked forward to the visits. They really, in the 8 weeks, it was difficult to do a shortened program because they were just developing a really strong relationship with their early learning specialist. And then to say it's over was difficult. So we were excited to be able to do the 24-week program this year. So as I said, this year we switched to 24 weeks. We did more educators. We upped it to 36. We used the 4-visit sequence, which is a little bit different than in our core program. In our core program, we go in twice a week, and the first visit we bring a book or a toy, and the second visit we work on extending that book or toy with some kind of activity. And then in this program, we would have that, the first visit with bringing in the new book or toy, the second visit with sort of extending it, but also talking with the provider and asking them what they would like to do with it on the next visit. And they didn't have to make that up on their own. We had several suggestions, but they could make up something if they got an idea and they were like, oh yeah, I want to do this with Very Hungry Caterpillar or whatever book it was. So the third visit would be a time that after our early learning specialists had modeled what to do, the provider would try it out. And then the fourth visit, they would kind of talk about what went well and what things they might like to do in the future and some planning. And then they also talked about developing a continuous quality improvement plan. And that was something that the state, it's not part of the National PCHP program, but it was something that our funder would like us to do. So they worked on that during the fourth visit as well. So we gave the ELS a lot of training and support, a lot more in the second year just because we had the timing for it. We wanted them to understand the FCC culture better and help the FCC educators understand that this program was going to help them improve their business. We also talked about working with multi-age groups because it was different for our people to work with multi-age groups. They're used to working with more one-on-one with providers and children. And then learning the whole continuous quality improvement plan, the QRIS, the FECRS was new to us, so we gave our ELS a lot of training on that as well. And then we have education providers and support grantees, so they're people who are available to help the FCC educators at a state level. And we tapped into them, and they gave additional training to our ELS so that they would help feel comfortable understanding the continuous quality improvement plan, explaining it to the providers, helping motivate them to participate so they knew why it was important. And then we had staff meetings weekly for all the early learning specialists. And then at different sites, some of the people had additional trainings depending on what was available at their site. And then some of them also had one-on-one supervision. And one of the things that we were doing, in addition to modeling while we were in the home, was making sure we were making referrals. So we were referring in two different ways. We were giving a lot of support to the FCC educators. So we were connecting them directly with all the training and the coaching and grants that are happening in our area so that they could take advantage of those. And some of them got some grants for equipment, and others got grants for having someone come in while they do ages and stages screenings and things like that. And then others was support for families to give to help the provider know if the child needed an ASQ screening or refer the family to early intervention and other kind of family supports. And then for both the educators and the families, we were connecting them to the community and all the different resources that are out there. Because sometimes people didn't know that there was a lot available that they could link into as a family child care educator. Through this grant, we were very lucky because we got to give a lot of additional literary supports. Aside from letting people know of the calendar of events and what was going on at the family and community engagement organizations, we gave them song cards, more books, lots of extension activities, and we were able to provide them with some literacy corners. And that was that varied depending on the provider, depending on what needs they had. Maybe they had space constraints, or maybe they had a bookcase already. We weren't going to just give them another bookcase. We allowed them to choose from some soft furniture, pillows, bookcases, baskets, things that would make the books more accessible for the children. Because we found that a lot of providers had a lot of books, but they weren't necessarily in an accessible area for the children. So this is just an example from our school, Leominster Public School group, that gave these pop-up butterfly chairs and pillows and bookcases to their providers. And then, of course, we were able to give them more books to add to their literacy corners.
Karen, would you be able to speak a little bit about how the program partners or works with the local child care resource and referral entities in the communities?
A lot of times the agency that was running the program, running the PCHP for FCC program, was involved with that agency, so they were aware of all the things that were happening and could then connect the providers with them through, several of them had different evening activities that the providers could go to, like literacy nights and training and STEM nights and things like that they encourage the providers to go to.
Okay. And would you overall describe the early learning specialist as a coach for the program? That was a question that a panelist was curious about.
Yeah, they're really a coach, a mentor. They're in there modeling what needs to be done. As far as the coaching specifically to develop the CQIP, we would connect them to the EPS grantees so that person who has that coaching experience and the knowledge of all the different parts of the continuous quality improvement plan would coach them with that. we were working in the 4 areas of listening and talking and activities and interaction, and we weren't experts in developing their business plan or something like that. So we would connect them to someone
Sure.
that could help them with that sort of thing. But we
Great,
got a lot of educators who, I'm sorry.
No, I said great. Thank you. Sorry.
No. A lot of educators who changed their curriculum, so they were trying to incorporate the PCHB toys and books that we were bringing in. They were improving their interactions with the children, asking a lot more open-ended questions and really allowing the children to make their own choices, which was something that the ELS were definitely modeling. Several had improved their routines. We had some new providers who didn't really have a good flow to their day. One of them had, I think she had 16 transitions going on throughout the day, so the ELS helped her to limit the number of transitions and to help the children like sing a song when there was time to clean up or to go to a new thing so the children would know what the routine was. And then the spaces, one of the providers cleaned out a closet in her playroom and made that a literacy corner. And another one just switched up her whole house. She decided to change the dining room to the play space because it had more space in it. And another one, the ELS was just helping to be another set of eyes and advise the provider when she had her layout. She had kind of everything pushed against the wall, and she helped her make it into sort of little centers where the children could do different activities. So just by our ELS being in there and having so much early childhood knowledge, they impacted so many more areas. It was really exciting. And they did connect the educators to a lot of different supports, and that warm handoff I think was so important to get that referral from a really trusted source. And the children were definitely very excited about the books. The providers were very, some of them did a lot of reading and didn't have any thought that the children wouldn't like the books, but a few of the providers did think, well, they'll like the toys, but they won't like the books. Or they didn't think that the earliest children would appreciate the books, the youngest children. And so our providers really helped them with that. And they helped model the fact that the children don't need to sit still while you're reading a book, that it's okay for them to be moving around, and that they're still learning, and that's still important to read. And this morning I got an email from one of the providers that our agency worked with, and she said that she had just gotten her additional books for her literacy corner. And they arrived at pickup time, and so they opened the books up, and the children asked their parents to sit and read the books with them, and they jumped from parent to parent to read all the different stories. So she was so excited that they had this impromptu reading event. So it was really cool. So this just talks about how our aim is to enhance early literacy and school readiness for home-based family child care, and keep our tradition going of ensuring that all children and families are ready for school. Thank you. If you have any more questions, I'd be happy to answer them.
Thank you so much, Karen. We are actually just a couple minutes away from the close of the webinar, so I was thinking that at this point, and as questions are still coming in, we'll make sure that we field them to you, and we will keep the chat room open for a little while after the close of the webinar. So if you're typing a question or if you haven't quite finished typing in your question, don't hesitate to continue. We will not close the chat. We want to keep, with this many attendees, we have to keep the chat open to make sure we don't miss anything that folks wanted to share with us. So we will keep it open here for a little while longer. Thank you to all of our speakers for sharing such great information with us. I think as we start to unpack this idea of the range of quality supports and the ways in which they may be delivered, one kind of closing thought or idea that struck me through listening to the presentations was, and I think we can see it from some of the questions in the chat box, was that connection with other resources and how we make sure that as we are working, whichever type of model we are delivering or quality support or technical assistance that we're delivering, we are aware of and intersecting with all of the other resources that are available for our family child care providers, and the things that they may not be aware of or connected to is such a critical piece, and not to assume that we kind of are meeting all of their needs through one particular modality of support, but that we can link them with other resources as well. I wanted to see if Danielle Fuentes-Johnson had a closing thought or summary piece for us as part of the webinar.
Thank you, Gina. I think the biggest thing that I've taken away today is that we've discussed these different ways to support family child care providers, whether it's offering support when we know they're not working and can possibly attend, or going directly into their home. That what's most effective and the most effective results come about through being responsive to providers, to what their goals are, their ideas, their needs, hearing them, seeing them, and making them know they're the priority. So that really was my biggest takeaway today.
Thanks for that, Danielle, and thank you all for participating. I see that we're still having more questions and intersection of resources across the group, and we will continue to make connections for folks that are asking for specific linkage to resources from either Parent-Child Home or from Adrienne or from some of the other participants that have shared resources. We will make these connections across folks even afterwards via email so that you're linked to some of these resources, and then we will also put up resources that have been shared in the chat as well as things that get emailed out. We will put those on the landing page for the webinar series, so that there is that one holding place that has all of the information available. We really appreciate the sharing back and forth and adding additional resources out there, and we appreciate the information and good questions that participants raised and the information that the presenters shared with us this afternoon. Thank you all for your commitment to family child care and being part of this webinar series.